Did you know that doctors can now predict whether you'll live independently in your 70s and 80s, or end up relying on a cane or even a nursing home simply by checking if you can do one exercise? It may sound unbelievable, but research proves it. And here's the scary part. Most seniors don't even try it. And that's why so many lose their independence far earlier than they should. Imagine two people, both 70 years old. One can rise from a chair without using their hands. They're active, mobile, and still enjoying life on their own terms. The other struggles to stand, uses their arms to push up, and feels weaker every year. Doctors say the difference between these two lives comes down to one thing: whether or not they practice this single powerful exercise. If you're over 50, this movement could be the most important habit you'll ever develop. And if you ignore it, you may be gambling with your independence, your balance, and even your brain health. Welcome back to a new video on Senior Secrets TV, the place where we uncover the real, science-backed strategies for seniors who want to live longer, stronger, and healthier lives. If you're new here, don't forget to hit that subscribe button so you never miss out on doctor-approved health secrets designed just for you. Now, let's get into it. The one exercise that doctors around the world recommend for every senior over 50 is the squat. Before you dismiss it as too simple or too hard, hear me out. The squat is not just a gym move. It is the foundation of daily life. Every time you sit down in a chair, get up from the toilet, bend to pick something off the floor, or rise from bed, you are essentially performing a squat. That's why doctors call it the functional king of exercises. If you can squat, you can live independently. If you lose the ability to squat, your independence slowly slips away. Let's break this down scientifically. After age 50, the body naturally begins to lose muscle mass at a rate of about 1% per year. This process, called sarcopenia, accelerates in the 60s and 70s. By the time many seniors reach 80, they may have lost up to 30% of their muscle strength if they have not actively worked to preserve it. This is why climbing stairs feels harder, walking becomes slower, and rising from a chair feels like a struggle. The squat directly combats this by strengthening the quadriceps, hamstrings, and gluteal muscles, the exact muscles needed for standing, walking, and balance. Research from the Journal of Strength and Conditioning research shows that seniors who practice squats regularly experience a significant improvement in walking speed, stability, and lower body strength. Another study published in Age and Aging found that the ability to stand up from a chair without using your hands is one of the strongest predictors of survival in older adults. In simple terms, if you can squat, you live longer and healthier. Now let's talk about why the squat is especially critical for seniors. First, it strengthens the thighs and hips, which are your body's natural shock absorbers. This reduces the impact on your knees and prevents joint deterioration. Second, it improves bone density, which is vital for preventing fractures. Every year, millions of seniors worldwide suffer hip fractures from falls, and many never fully recover. But weight-bearing exercises like squats send signals to your bones to stay strong, reducing fracture risk. Third, squats improve balance. When you lower and raise your body, your core and stabilizing muscles engage. This keeps you steady on your feet and drastically lowers the chance of falling, the number one cause of serious injury in seniors. But the benefits don't stop there. Squats also improve circulation, reducing swelling in the legs. They enhance digestion because the movement massages the abdominal organs. They even support brain health. How? Every squat increases blood flow to the brain, delivering oxygen and nutrients that keep neurons alive. In fact, recent studies show that leg strength is directly linked with slower cognitive decline. Doctors now believe that the legs are not just for movement, they are a powerhouse that keeps the brain young. Now I know what many of you may be thinking, but doctor, I have bad knees. I can't squat. Here's the good news. You don't have to squat like an athlete. There are modifications for every senior, no matter your condition. If you have knee pain, start with the chair squat. Place a sturdy chair behind you. Slowly sit down and then stand up, using your legs as much as possible. At first, you may need to push off with your hands. That's fine. Over time, try to rely more on your legs. Even just 5-10 chair squats a day can strengthen your lower body dramatically. If balance is a problem, use a wall or railing for support. If mobility is limited, start with partial squats, only lowering a few inches. The key is not depth, but consistency. Even shallow squats activate the critical muscles. Physical therapists often say, a small squat is better than no squat. And they are right. Progress comes slowly, but it comes. One of the biggest misconceptions is that squats damage the knees. The truth, backed by medical research, is the opposite. When performed correctly, squats strengthen the muscles around the knees, stabilizing them and reducing pain over time. The problem is not the squat itself, but years of neglect. Weak muscles leave joints unsupported. Squats rebuild that support. This is why orthopedic specialists often prescribe squats as part of rehabilitation for knee arthritis. Done carefully and consistently, they are medicine for your joints. Let's also talk about breathing. Many seniors unknowingly hold their breath during movement, which increases blood pressure. When squatting, focus on breathing out as you rise and breathing in as you lower. This simple habit protects your heart and keeps the exercise safe. In Japan, elders often combine squats with deep breathing, turning it into both a physical and mental refresh. Now let's consider the long-term picture. A senior who practices squats daily is training for independence. They will be able to rise from chairs unassisted, walk without shuffling, and avoid many of the accidents that send peers to the hospital. Meanwhile, a senior who avoids squats gradually loses strength, needs help with basic tasks, and becomes more vulnerable to falls. The contrast is profound, and it can determine whether you age actively or passively. Culturally, this is why elders in places like Japan and Korea remain more mobile. Their daily routines naturally include squatting, whether sitting on floor cushions, gardening, or preparing meals. Western lifestyles, on the other hand, rely heavily on chairs, couches, and cars. The result? Many seniors lose the ability to squat entirely by midlife. But the good news is you can reclaim it. With patience and practice, your body will respond. Doctors often say, motion is lotion. Squats are the ultimate lotion for your legs, hips, and spine. They keep the joints lubricated, the muscles engaged, and the bones stimulated. Without them, stiffness sets in, and weakness accelerates. With them, strength returns, mobility improves, and life feels easier. So my prescription for you today is simple. Start squatting. Do it safely, do it daily, and do it at your own pace. If you can manage 5 squats, do 5. If you can manage 10, do 10. Over weeks and months, you will notice profound changes, not just in your legs, but in your confidence, balance, and energy. Thank you for watching this video on Senior Secrets TV. If you found this information valuable, make sure to subscribe for more doctor-approved health secrets tailored for seniors over 50. Share this video with a friend or loved one who needs to hear it, because the one exercise that can change their future is often the simplest one. Stay active, stay strong, and I'll see you in the next one.